Hi there. December 2017 saw the introduction of the renewed cervical screening program in Australia and the release of the associated updated cervical screening guidelines. This has presented some management challenge to clinicians as we all try to adjust to the updated guidelines and the change in management. What we're going to do today is aim to discuss some of the more commonly encountered clinical challenges to try and assist us in making sure that we're providing the right test at the right time to our patients with appropriate follow-up in place. All of the cases discussed today and the information are taken directly from the updated guidelines, which can be found at the website shown on the screen now. Another group that I want to talk about are underscreened women. So we know that there is a new option that for self-collection, and that applies to women who are underscreened, so women who are over 30, who are more than 2 years overdue for screening, are regarded as being underscreened. These women are eligible for Medicare rebatable self-collected HPV testing. We would want to reserve it though for patients who just for whatever reason are unable to have a clinician collected sample or who have continued to decline that. So the first option and the best practice screening method is for a clinician collected sample. But we do want to somehow capture those underscreened women who for whatever reason just cannot have a clinician collected sample. So these women do have the option of being offered a self-collected sample. This self-collected sample will happen at the clinic, either behind the curtain, or we'll send them off to the bathroom at the clinic. It's a self-collected swab that the woman inserts into the vagina herself, much like using a tampon, and then that gets sent off to the lab for a HPV DNA test. Again, it's not as good as a clinician collected sample, but it is a way of capturing these women because we do know that 80% of our cervical cancers are still occurring in our underscreened women. So it is a good strategy to capture these women and ensure that they are still somehow screened. We don't endorse the commercially available self-testing kits. That's not part of the National Screening Program. The self-collection option is really something that needs to be talked through with the woman in the clinic setting and performed on the clinic premises after the woman has been fully informed.